Hello everyone, this is Kerry Anderson. Hope you all doing well. In today's video, I'll be talking about stress effects on the body. So if you like the video related to my health, I would like to request you all, please do subscribe the channel, hit the bell icon and give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin, let's go. Stress effects on the body. Our body are well equipped to handle stress in small doses, but when that stress becomes long-term or chronic, it can have serious effects on your body. Now, musculoskeletal system. When the body is stressed, muscle tense up. Muscle tension is almost a reflex reaction to stress, the body way of guarding against injury and pain. With sudden onset stress, the muscle tense up all at once and then release the tension when the stress passes. Chronic stress causes the muscle in the body to be in a more or less constant state of guardedness. When muscles are taut and tense for long periods of time, this may trigger other reactions of the body and even promote stress-related disorder. For example, both tension type headache and migraine headache are associated with chronic muscle tension in the area of shoulder, neck, and head. Musculoskeletal pain in the low back and upper extremities has also been linked to stress, especially job stress. Millions of individuals suffer from chronic painful conditions secondary to musculoskeletal disorder. Often, but not always, there may be an injury that sets off the chronic painful state. What determines whether or not an injured person goes on to suffer from chronic pain is how they respond to the injury. Individuals who are fearful of pain and re-injury and who seek only a physical cause and cure for the injury generally have worse recovery than individuals who maintain a certain level of moderate physician-supervised activity. Muscle tension and eventually muscle atrophy due to disuse of the body all promote chronic stress-related musculoskeletal conditions. Relaxation techniques and other stress-relieving activities and therapies have been shown to effectively reduce muscle tension, decrease the incidence of certain stress-related disorders such as headache, and increase a sense of well-being. For those who develop chronic pain conditions, stress-relieving activities have been shown to improve mood and daily function. Respiratory system. Now, the respiratory system supplies oxygen to cells and removes carbon dioxide waste from the body. Air comes in through the nose and goes through the larynx and the throat, down through the trachea and into the lungs through the bronchi. The bronchioles then transfer oxygen to red blood cells for circulation. Now, stress and strong emotions can present with respiratory symptoms such as shortness of breath and rapid breathing as the airway between the nose and the lungs constrict. For people without respiratory disease, this is generally not a problem as the body can manage the additional work to breathe comfortably, but psychological stresses can exacerbate breathing problems for people with pre-existing respiratory disease such as asthma and chronic obstructive pulmonary disease. Some studies show that acute stress such as the death of a loved one can actually trigger asthma attack. In addition, the rapid breathing or hyperventilation caused by stress can bring on a panic attack in someone prone to panic attack. Now, working with a psychologist to develop relaxation, breathing, and other cognitive behavioral strategies can help. Now, cardiovascular system. The heart and blood vessel comprise the two elements of the cardiovascular system that work together in providing nourishment and oxygen to the organs of the body. The activity of these two elements is also coordinated in the body's response to stress. Now, acute stress that is momentary or short term, such as meeting deadlines, being stuck in traffic, or suddenly slamming on the brake to avoid an accident, causes an increase in heart rate and stronger contraction of the heart muscle, with the stress hormones adrenaline, noradrenaline, and cortisol acting as messenger for these effects. Now, in addition, the blood vessel that direct blood to the large muscle and the heart dilate, thereby increasing the amount of blood pumped to these parts of the body and elevating blood pressure. This is also known as the fight or flight response. Once the acute stress opposite has passed, the body returns to its normal state. Now, the chronic stress or a constant stress experienced over a prolonged period of time can contribute to long-term problems for heart and blood vessel. The consistent and ongoing increase in heart rate and the elevated level of stress hormone and of blood pressure can take a toll on the body. This long-term ongoing stress can increase the risk for hypertension, heart attack, and stroke. Repeated acute stress and persistent chronic stress may also contribute to inflammation in the circulatory system, particularly in the coronary arteries, and this is one pathway that is thought to tie stress to heart attack. It also appears that how a person responds to stress can affect cholesterol level. Now, the risk for heart disease associated with stress appears to differ for women depending on whether the woman is premenopausal and postmenopausal. Level of estrogen in premenopausal women appears to help blood vessels respond better during stress, thereby helping their bodies to better handle stress and protecting them against heart disease. Postmenopausal women lose his level of protection due to loss of estrogen, therefore putting them at greater risk for the effect of stress on heart disease. So that's all about the diabetes in this video. I hope you all liked it. So I'll definitely come with the next video with my upcoming content, with the next content. Till then, God bless you. Stay home, stay safe, take care of yourself and your family. God bless you. Take care.